and have a 1 hour time where you pause, stop everything, and take deep breaths and be grateful for what you have, because we have a lot to be grateful for, just a lot.
Hello, everyone, and welcome to the Push Pause to Heal podcast. I'm Dr. Emily Rodersheimer, and today I have such a special guest, a dear friend, colleague, and neighbor, Dr. Emlah Tubuo. I'm going to tell you about Dr. Emlah real quick, and then we'll dive right in. Dr. Emlah Tubuo is the host of the Intentional Living podcast with Emlah, a TEDx and keynote speaker. She owns Powell Pharmacy, an integrative pharmacy in Powell, Ohio, as well as Emlah's Naturals, a third-party tested dietary supplement line. Her focus on whole person health emphasizes her pharmacy practice philosophy of there is more to health than prescriptions. I love that. And
Yes.
Her work is based on the pillars of intentional living: nutrition, movement, inner alignment, and positive social connection. So I'm so happy that you're here, Dr. Tubuo. Emlah, we're good friends, so hopefully you don't mind if I call you Emlah.
Oh, please just call me Emlah. Thank you. Thanks for having
Yeah.
me. I'm honored to be here.
Excellent. So a lot of my listeners, I think, are new to the concept of an integrative pharmacist. Can you tell us, what does that mean and how did you end up here?
So I'm so happy to be on this podcast, and just because we align on so many levels. And originally, as a pharmacist, I knew that I wanted to practice differently. And my goal, originally I'm from Cameroon. So my backstory, West Central Africa, developing country, grew up in a place that was completely immersed in infectious disease. So think about it: cholera, dysentery, typhoid. These are things which sound like something that you learned in school during your infectious disease course, but these are things that I dealt with as a child. I had cholera, typhoid, dysentery numerous times, and had malaria more than I'd care to count. Over 35 times I had malaria. So, and that is not unique to me. That is unique. That's commonplace in every child who grew up in West Central Africa. So I grew up thinking, you know what? I just wish there could be a space where I don't have to worry about malaria every other week or malaria every other month. And hoping and aspiring to travel to a developing country where I don't have to deal with infectious disease. And that my dream came true. I was able to come to the United States. I did my master's in Chicago, and I did my doctorate here in Ohio at the Ohio State University. But during that study, as I started my doctoral of pharmacy studies, I gradually began to realize that we're suffering from a different type of problem. It's no longer infectious disease. It is chronic disease. And the difference with infectious disease and chronic disease, when infectious diseases, most of them hurt, like the ones like you feel like the symptoms, you have the diarrhea, you have the body pain and all the things from malaria. If I have typhoid, cholera, dysentery, or malaria, I know I'm in pain, I'm down. But you could have type 2 diabetes for 20 years and not know. You could have all these underlying chronic diseases, which just are silent killers. And the rate at which cardiovascular disease is affecting our situation, our health care. So as a pharmacist, you graduate from pharmacy school and filling prescriptions every day. And that's really what the mainstream pharmacist does, working at a big chain. But it just did not align with me, because I came from a place where we use whole person health a lot more. So in my desire to figure out how can I practice the way I really want to, not the way the big chain pharmacies are telling me to. And that's really what drove me to opening Powell Pharmacy. So I could take care of people the way I want to be taken care of, taking into consideration food, rest, movement, inner alignment, and just all the other things that are very essential to health, but we cannot minimize.
I love that. Wow. Like chills, really, to think about where all you used to deal with. And like you said, as terrible as those conditions are, at least you knew you had them,
Yes,
right?
yes,
I'm so glad that you came here where you don't have to worry about those things. So now your heart has shifted into helping people with those silent diseases that aren't as obvious. And boy, we're so lucky that you're here. So so glad to have you. So thank you for sharing that. And I think one of the things that I find so fascinating about an integrative pharmacist is the role that you play in helping the people on prescriptions realize potential nutrient depletions they might have from their prescriptions.
Yes.
So I think this is a new concept, likely for many of my listeners. Would you mind diving into that a little bit for us?
Oh, I'd love to. I love talking about this. So this is called drug-induced nutrient depletion. And before I jump into drug-induced nutrient depletion, I want to talk a little bit about nutrient depletion as a whole before coming to the one that is caused by drugs. So when we talk about a nutrient in our body, all these nutrients are helping us. We have, all our macronutrients, our micronutrients, helping us lead the ultimate life and optimal healthcare that we're supposed to be leading. But sometimes because of certain situations, I do not have the absolute nutrition. And that could just be maybe some malnourishment. Okay, think about it. I could be a vegetarian. And just because I'm vegetarian or just because I'm vegan, I'm not consuming enough animal products. I'm not consuming animal products. So just by my lifestyle, I have the tendency to be deficient in vitamin B12. So when a vegetarian walks into Power Pharmacy, when a vegan walks into Power Pharmacy, the first thing, once you disclose your lifestyle to us, the first thing we're giving you is a B12. It's non-negotiable because just by lifestyle, they have the tendency. So we'll measure that and then replenish so that if you're an athlete, a well-trained athlete has the tendency because they're using up their muscles, using up all their electrolytes. Well-trained athletes have the tendency to be depleted in magnesium and the electrolytes. Mm-hmm. So you see they're drinking Gatorade every day, but we don't want the sugar, so we're better off just giving them their multi-minerals. So just by things like that, so different things are depleted. And then think about a woman who is pregnant. Mm-hmm. You're expecting a baby and we need to replenish your folic acid because the baby is getting some of that, the fetus is getting some of that folic acid from you. So we need to replenish that folic acid in you because the baby needs that folic acid to build its central nervous system. And so just the fact that you're pregnant, you're probably going to be low in folic acid. And there's lots of studies. So we need to give you a lot more folic acid than the average person needs. So there are different things that deplete nutrients, and medications happen to be one of them. So drug-induced nutrient depletions are the ones that, everybody wants to lead an optimal lifestyle. Everybody wants to be healthy. I've not met anybody who doesn't want to be healthy. So think about it. I'm not feeling well and I come to you, my physician, say I go to my primary care, I hit up my GP sits there and then gives me a prescription for metformin and says, oh, Emlah, you have diabetes type 2. The first prescription on the guidelines that we're going to give you is metformin. I'm like, okay, thank you. Metformin is going to reduce my blood sugar levels. Thank you. And so I start taking my metformin, and guess what metformin does? Metformin is actually reducing my blood sugar levels, but metformin is also reducing my vitamin B12 in my body. So that's just how metformin works. So I'm a pharmacist. As a doctor of pharmacists, I have seen firsthand the benefit of medications, prescription medications. So I am not saying stop taking your metformin. I'm saying take your metformin every single day, but be aware of the fact that while you take your metformin, it is depleting your B12. And B12 vitamins are very essential to protect your nerves. Because think about this, 5-10 years from today, most people who have diabetes, especially if it's controlled type 2 diabetes, will end up with something which we call diabetic neuropathy, which is nerve pain that is coming from unprotected nerves, peripheral neuropathy. So the fingers and their toes, so they just start having all this nerve pain. And usually the next line in that is to give them another prescription for duloxetine or another prescription for Lyrica or for gabapentin to take care of that nerve pain. And nerve pain is something I do not wish on anybody. It only goes downhill. It's really hard to come back from nerve pain. So it's really a place I don't want any of my diabetic patients to go. So we could just sit here and say, oh, we'll give you metformin. You take metformin for the next 5-10 years, and then we'll diagnose you with diabetic neuropathy, because that's just the progression, the natural progression of the disease state. It's just going to go like that. Or as an integrative pharmacist, my goal will be, I want to protect you from getting there. I want to prevent you from getting there, right? Protection and prevention is the new urgency. So I'm not going to wait for you to get there. I'm going to say, okay, Dr. Rodensheimer, if you're taking your metformin every day, what I need you to do is to take a B12 every day to protect your nerves so we don't get to diabetic neuropathy.
Wow. Like, wow. I mean, you are here to make sure that, and you're not just, you could very easily just give someone their prescription.
Oh, yeah.
And have them go on their way. But
Yes.
You're going out of your way, Dr. Tubuo, to spend extra time, educate that client, and help support them to avoid very painful diabetic neuropathy. So what a blessing you are. And so I want to say thank you for that. Thank you for sharing that with my listeners. I would love it if you could talk. There are two other prescription types that I think are very, very common that I'd love for you to just touch on briefly. The first one being statins,
yes,
and what the nutrient depletions that may come there. And the second being the PPIs, the acid reflux medications. Can you tell us about what happens with those?
I would love to do that. So the thing, at my pharmacy practice, as an integrative pharmacy practice, this is what we do. The goal is to spend time and educate. So the goal is like nobody wakes up coming to the pharmacy and goes, my goal is to come and pick up some metformin today. I just want some metformin on my grocery list. Nobody has metformin on their grocery list. Nobody has a statin on their grocery list. They take it because it is prescribed to help us feel better. The goal is the end goal is to feel better. The end goal is to have a healthy lifestyle. The end goal is to lead a fulfilled and exciting life so we can spend time with our children, grandchildren, friends, and community and do the fun things that we're supposed to be doing. And the fun thing is not taking a statin. The fun thing is not taking the metformin. So taking the metformin or the statin is a way to get to the fun thing. So my goal is to help you get the optimal benefits from that as a pharmacist. Sometimes it includes taking a statin. Sometimes it includes not taking a statin. But if you have been prescribed a statin, if a prescription for a statin comes to our pharmacy, we fill that statin and then we make sure that we talk with you. I'm not going to give you that statin if we don't chat. So I'm going to say, here's why your provider has prescribed a statin for you. This is how a statin works. A statin goes in there and blocks a certain pathway, which is called, another way we call the statin is an HMG-CoA reductase. So it blocks this enzyme, so the statin is inhibiting HMG-CoA reductase. And when this enzyme is inhibited, it blocks a major pathway in the production of cholesterol. And cholesterol is important in our body. We need it for cell membrane synthesis. We need it for neurotransmitter synthesis. Think about your feel-good neurotransmitters, serotonin, dopamine, endorphins, all your cell membranes. You need it for steroid hormone synthesis. We need cholesterol, but we don't need a lot. So what happens is your body is producing a lot of cholesterol, either from your food, lifestyle choices, or from your genetic component. So we're getting that, and you take the statin to block that. And the problem is that same pathway that produces cholesterol is the same pathway that produces CoQ10. And CoQ10 is very essential in the energy production in your muscles. So especially cardiovascular muscle and skeletal muscle. So normally in pharmacy school, the first thing they tell us about statin is that if you give somebody a statin, the first thing you tell them is that there is a chance that this can cause some muscle pain. So if you go and you start taking this statin and you feel some muscle pain, reach out to your physician. Your physician will either reduce the dose of the statin or give you a different statin. And that's kind of how it is. That's how we're taught in pharmacy school. And we don't go deep into what could we do? Could we just, let them have the muscle pain because, that's a side effect that comes with the statin? Or we can replenish CoQ10 when they pick up the statin. And when we replenish this CoQ10, we get the benefit of reducing the cholesterol synthesis, but we're replenishing with CoQ10. And that is drug-induced nutrient depletion. And then, so I call them the nutrient thieves. So this, good nutrient thieves. So statin is a nutrient thief. So it's coming in to reduce cholesterol, but it's stealing something good from our body, and we're like, I caught you, statin. I gotta put back this CoQ10 that you're stealing from my body because I need my CoQ10 to reduce fatigue. I need my CoQ10 to keep my heart muscle pumping really well so it can pump blood to the rest of my body so that way that fatigue doesn't set in, when the muscle pain doesn't step in.
Amazing. I imagine the compliance rate of someone coming to the PAL pharmacy to prescribe a statin is much higher because they're not ending up with the muscle pain and the fatigue that can come from taking a statin. So again, beautiful work.
My goodness. We just had a patient the other day with a creatinine kinase of 600 and something. This is an enzyme in the body which only goes up if muscle has been broken down. Mm-hmm. So this patient just started taking a statin and they've been on the statin for about 3 months. And she goes, I don't feel my body. I feel like I'm going to pass out. Like my body hurts. I can never go to the gym. It hurts. She's trying to do the lifestyle changes, but because she's taking the statin, her creatinine kinase was 600 and something. And she goes, I went back to my doctor. My doctor said, maybe we'll try a different statin. So I actually stopped taking it for a few days and I started feeling better. I go, I know why. So what we're going to do is we're going to put you on CoQ10. You're going to wait a little bit. You're going to start the other statin. We're going to figure out there's options. Yes, we have plenty of options. There's no reason suffering with one option. Meanwhile, we have all these options around us, and rhabdomyolysis is nothing I wish on anybody.
Well, and it's such a simple fix. It's so simple. And CoQ10 is a beautiful supplement to take on so many levels. So it's a shame that it's not, utilized more often. But thank you for that wonderful explanation. And can you tell us about those lovely heartburn medicines? We call them PPIs or proton
lovely heartburn. She called them lovely heartburn medicine. This is the PPI, stand for proton pump inhibitors. And so commonly you would see like the omeprazole, like the lansoprazole and rabeprazole. You will see all these medications. They work very well. They work like magic. But they were studied to work for 14 days. They were studied to help with the acid reflux or GERD for 14 days. But the problem is that because they work so well, we want to be on them forever. After those 14 days, you're like, oh, I need a refill. And, if your doctor gives you a refill, you take it. I have people who have been on a PPI for over 10 years.
Whoa.
Yes. But the problem with PPIs is that PPIs go in and they prevent your body from absorbing calcium. This is just one of the problems with PPIs. They prevent your body from absorbing calcium. And as they prevent your body from absorbing calcium, it predisposes you to osteoporosis down the line. So imagine if you and I were twins and you were taking a PPI and I'm not taking a PPI. When we hit 65, because you've been taking that PPI for a long time, you have a higher chance of developing osteoporosis than I do. Wow. Meanwhile, as a woman, I already have a very high chance of developing osteoporosis. So with taking a PPI on top of that, stacking that risk upon risk, it just makes it worse. So 1 in 2 women will have a broken bone from osteoporosis over the age 50. That's crazy.
That is crazy.
But that's not even the bad statistic. The worst one is that of the 50% of women who will have that broken bone, 20% of them will die within that year of having that broken bone. From things just going downhill. After the broken bone, they go to the hospital acquire pneumonia. It just goes downhill from there. Blood clot chances from immobility. It's just one step after. So when any patient comes to me and they're taking PPI, my goal is, let's see for how short of a period you can take this PPI. Let's figure that out. And then let's go deeper. As an integrative pharmacist, I'm not just looking at, tunnel vision on the prescription. This is your omeprazole. Take 30 minutes before your breakfast and be done. No. What happened in your stomach before we're taking this? We're blocking those acid pumps that are pumping acid to break down your food. What are we causing down the line? How can we rectify this? How can we protect your microbiome while on this? I need to give you a probiotic while you're on this acid proton pump inhibitor. We want to make sure that you stop it soon enough. We want to make sure that you're getting some fiber. We want to make sure that you're taking some B vitamins because your and you want to take some calcium. So we protect from this osteoporosis. So those are some of the things that we do as an integrative pharmacy, taking pharmacotherapy and lifestyle-based therapies and just all putting everything together in as whole person health, because it's really, we're using that knowledge, the science and the evidence, pharmacology and the pharmacotherapy that we have, and putting it together, stacking it with daily life decisions to make sure that we're getting the best for our health.
This is really phenomenal. And just the downstream effects of what you're doing, right? You're stopping or much significantly lowering the risk of osteoporosis because of a conversation that you're having.
Yes.
Or you're just helping someone to realize, hey, this PPI was never really intended to be something you take for 10 years. Let's talk about that, because the doctors are busy. Often they're not having this conversation, right? They have a lot going on. So it's so beautiful that you do have these conversations. And, I just think that the power of this type of education, and it just can't be, there's nothing there's no other place for this to happen if it's not happening in the doctor's office than with an integrative pharmacist. So thank you.
It is important. You're welcome.
Important.
And my goal is I always remind my patients that, if the doctor prescribes a statin to you, if you've heard me talk, don't think that is bad faith. There's nothing about bad faith there. There is no healthcare provider who wants to jeopardize your health. So, and that's what I always try to clarify people that as an integrative pharmacist, my goal is I'm not against medicine. My goal is how can we integrate? The word is there, integrate. It's an addition to, not instead of. So there's a place and time for medicine. I have seen medication, life-changing benefits of medication. There are patients, use your personal story. You had methotrexate for a long time, Enbrel for a long time, and that helped you, get to where you are. You can't tell anybody, stop taking your methotrexate today. I would say take your methotrexate, dear, but I'm going to give you folic acid while you're on that methotrexate.
Yeah.
I'm not going to let you take methotrexate by itself. I'm going to give you folic acid. And while I'm at it, I'm going to make sure that I'm giving you a methylated full B complex. So you're not just getting only the folic acid, you're getting all the other B vitamins because they work in synergy. That is the role of an integrative pharmacist, like looking at your whole body and not just your one prescription of methotrexate.
And then on top of that, you have the the pillars of intentional living, which we are so in alignment here. So I'm going to let you speak about your pillars of intentional living. Very much, you and I are realizing that the lifestyle choices in our society are driving illness or can help bring us back to wellness. And so tell us what you see as the pillars for intentional living.
These are the pillars on which I founded my practice. And because I did that because these are the pillars on which I founded myself. I am blessed to have gone through such a difficult childhood that really shaped who I am today.
Yes.
And I am grateful for every minute of it. And I believe in God, and I thank God for giving me the opportunities that He gave me, and the suffering and the journey that He gave me, and the ability to go through it, and the ability to articulate that and use it to teach other people. So right now, my goal is when we think about our health, you think of a table that has 4 legs. And you think of the individual legs of that table like your pillars of intentional living. And the first leg is nutrition. The second is movement. The third is inner alignment. And the fourth is positive social connections. And when you put those legs on that table, if any of them begins to wobble, or you break any of those legs, the table is going to be wobbly, the whole table. And the surface of the table is that whole person health. And we can stack things like supplements or prescriptions on top of it to augment. So like supplementing any of those legs. So if on my nutrition, I'm a vegetarian, right? The leg, which is nutrition, might be shaky. And so what I need to do is give a B12 to augment that. Think about the movement leg. The movement leg, if that's shaky because I've not been moving my body, I'm not going to the gym, I can just walk after my meal. I can go on a walk every Saturday with my girlfriends. I can go to a dance class because I love to dance. I personally love to dance, so I go to a dance class with Kate every Saturday. So, but think about that. And then my inner alignment, mindfulness, gratitude, journaling, those things that cost me $0 to do.
Yes.
I'm on I think we're on the 760 something streak with my daughter on gratitude journaling.
Oh, wow.
And non-negotiable. That inner alignment has to be in place. And also we measure our biomarkers. I'm doing my Journeys program now, and we measure vitamin D, omega-3. We take all these measurements so that you can just be assuming and putting the keys of your health into somebody else's pocket. And the final pillar of positive social connections, you cannot do it alone.
Oh.
You can't. You can't do it alone. You need people. There was an 85-year-long Harvard study which showed that the single greatest predictor of a fulfilled life is the quality of your relationships.
Wow. And, I think we all have struggled a little bit through COVID, and, there was so much loneliness and isolation. Yes. And so I think we're starting to find ways to avoid that now. Yes. But I love those pillars, and the fact that a pharmacist is actually considering that is just beautiful. So beautiful. And I am curious, what have you seen in your day-to-day life? You live a very intentional life yourself, and you've got your daughter practicing right along with you. And how do those pillars show up for you? What do you find the benefits of leaning into those pillars for you?
I personally, I explain it to my children and my staff that I use the pillars as a yardstick to answer questions for myself. So if Dr. Rodensheimer invited me to this podcast, my question is going to be, what aspect of her podcast aligns with any of my pillars? Is it building any of one of my pillars, or is breaking it down? If the answer is yes, it's building it, I'm going to fit it in my calendar. Mm-hmm. And if it's not helping one of my pillars, that's a sign, that's a whisper to me that, Emlah, this really doesn't need to be on my plate today. I think about it when I open the pharmacy. Most pharmacies are open 9 to 9, 9 to 7. But I look at my identity, and my identity is a mom prior to being a pharmacist. I'm a wonderful pharmacist because I'm a wonderful mom, and vice versa. Mm-hmm. So I cannot compromise my motherhood for being at a pharmacy. So I decided that Power Pharmacy is going to close at 5. There's some sacrifices financially for that, open later on after 5, we could be filling more prescriptions, making more money. Money is very essential. Financial stability and literacy is very important on the table, but you have to prioritize, you have to take into consideration all the other things. Is it important for me to be at my son's soccer game? Absolutely. So I will shut down the pharmacy, and you will find me watching my son's
at the soccer game. I love it.
Just hanging out at home on a Friday night or a Friday dance party with my children in the basement. And
well, I just love that. I mean, that is really you use the pillars. You're so intentional about your life in reflecting, are these choices that I'm making day to day going to strengthen my pillars or weaken them? And that's very similar to what I've had to find in my life. What the food I eat, is that going to help me? Is it going to create inflammation? Are my joints going to swell up, or are they going to serve me? So it's all, and in our society, everyone's on a hamster wheel, and it's really hard to be intentional, right? It's so hard to think when you're just trying not to fall on your face on that hamster wheel. So I would love to talk for just a minute. This is the Push Pause to Heal podcast. I try to help normalize rest and taking breaks for people, especially women who aren't so good at that, to have space to be intentional with our life, right? And not just keep going and never think about how is this the right direction. So tell me a little bit, if you could write a pause prescription for women listening today, or even for yourself, can you share what you think that would be?
Well, I always say, it's even a computer, you have to sometimes unplug it. It's overheating, you unplug it, so at the pharmacy, we take a break. At Power Pharmacy, we have at the top of the hour, every top of the hour, we have an alarm. It just goes off in the back. Time for squats. And so we do 15 squats at the top of every hour at the pharmacy.
What? I love that.
If you're welcome to visit Power Pharmacy at the top of the hour and you join in on our squats, So we used to do 10. We used to do 10 squats at the top of every hour. But my pharmacy manager, Ronnie, when she went on maternity leave, she came back and she goes, I have all this baby weight to lose. We're going to have to do 15 squats because I'm not feeling like the 10 is not getting it. And I'm like, okay, I guess we're doing 15 squats now. Just think about that. At the top of every hour, it goes, it's time for squats. We stop what we're doing. If you're counting a prescription, you stop it. That prescription will be there when I come back. I'll do my squats and pay some attention to my breathing and do those squats. So think about the number of squats we'll do by the end of an 8-hour day that we work together. And after that, people are usually giggling, people are laughing, there's something's funny, and there's always something like that. So that's one way we pause in the middle of our day.
Yes, that's beautiful.
Yeah, in the morning, I wake up before my children. I make sure I wake up 1 hour before my children because that's a me time, and just pause and say, how am I getting into this day? I journal during that time. I work out, then I journal during that time. So if I'm lifting or I'm riding, and then I do that for 30 minutes, then I sit down with myself and I say, who do I want to be in the world today? And how am I going to show up as that person? It could be one sentence. Sometimes it's a whole page, depending on what's going on in my mind, in my life as a person, as a mom, as a business, as an entrepreneur, as a teacher. So every day I'm one or all of those. And so how do I show up uninterrupted? How do I show up intentional and not overwhelmed? So I just take it easy, one step at a time in the right direction. So small, consistent steps in the right direction. And so that 1 hour is my pause time. And I invite you to start squatting at the top of the hour or come visit me at the top of the hour and we'll squat together, or wake up before your children, or go to bed 1 hour after your children, and have a 1 hour time where you pause. Stop everything and take deep breaths and be grateful for what you have, because we have a lot to be grateful for. Just a lot.
I could not have said that any better. That's beautiful. First of all, I'm going to have to stop in at the top of the hour. And I was thinking, actually, even before you said that, what a beautiful place the Pal Pharmacy is, because if you ever walk in the doors, you are enveloped in positive social connection. I mean, somebody's very happy that you're there. You're getting greeted. There's just joy in the building, and that comes from the top down. I love to hear that.
Thank you for saying that.
Yes. Well, I think there's something to be said about you being intentional and taking that time in the morning to decide who you want to be that day, how you're going to show up. And then that trickles out, Emlah, to your staff, your children, obviously your spouse, your community is all impacted. So I think that it's such a blessing that you took that time for yourself, blessed everyone in your life. And I would love our listeners to consider the same for themselves. If you're not pausing at all currently, and an hour sounds like a lot, just start with 5 minutes and build from there. I don't know about you, Emlah, but I know when I do pause, or, as I found the power of the pause, I crave it. Yes. It's like delicious.
Oh, I love it.
Oh, it's better than chocolate, right? It's like
I mean, chocolate comes really close, though. Chocolate comes very close.
That's true. I will say, maybe we pause with our chocolate.
The other day, my daughter, she was going to a birthday party, and so I dropped her off at the store, and I sat in the car, and I said, I'm going to take some time for myself, and while you go in and buy your friend's gift. And so she went in and bought the gift. She came with her bag from home and everything, and so she bought the gift, and she walked into the car with a piece of chocolate for me. And I took it and I was like, oh. And she goes, Mom, you have no idea. I could pay anything to the look on your face when you eat a chocolate. It's like, it's just funny that chocolate can do that for you. And I'm like, well, you're welcome. And I had this chocolate in my mouth. I couldn't talk. And I was like, So I had my pause and I had my chocolate.
That's perfect. I think a pause and chocolate go well together. And, finding joy in those small, like a piece of chocolate brought you so much joy. And we forget about that. Sometimes when we are on that hamster wheel, we miss the joy. Yes. And so I love all these lessons that you've taught us today, Emlah. And I would say that the Pal Pharmacy can serve anyone in Ohio. If you have prescriptions that you're currently at Walmart or Walgreens where unfortunately the pharmacists aren't integrative and they don't take the time to have these conversations with you, I invite you to switch over to the PAL pharmacy, which you can ship, correct, anywhere in Ohio.
Yes, we can ship anywhere in Ohio. Yes, we take care of our patients and we do compound as well. So think about it like that's something like for patients that you see. I know you do a lot with patients and their hormones as well. Think about it, something like progesterone. Progesterone is a wonderful hormone that will help women, feel better or help them fall asleep and stay asleep. But it only comes as 100 milligrams and 200 milligrams. Those are the only two pharmaceutically available strengths. So think about it. What if a patient needs 150 milligrams? What if a patient needs a sustained release versus an extended immediate release? We're able to compound that. We're able to make customized medications for not only for women, for children, for everybody in the family, for pets as well. We customize veterinary medicine as well, make it into solutions that are we are able to take care of the patients and mail prescriptions within Ohio, and we're able to mail our supplements out of Ohio.
Yeah, and, excellent.
Yes.
Well, I hope our listeners will preferably stop by and do some squats with you. But if they live farther away, then maybe they can take you up on the mailing aspect.
Absolutely.
This has just been a pleasure, Dr. Emlah, and I would love for you to share how can, aside from the PAL Pharmacy, how else can our listeners follow you?
So what I do primarily, my biggest thing is education. I love to speak. And so currently I do keynoting. And so if your listeners would like me to come speak for their company work and a group of people, I'll give you a link that you can put in the show notes for them to book me to speak. And when I'm not speaking, I am at the pharmacy meeting patients with a comprehensive health review. So people bring in all their supplements, all their medications. They sit down with me for 45 minutes and we go through every single one of them. And that is one of my favorite things in the world to do, just a comprehensive medication review and which one's important, when to take them, what to take into consideration, how to put these supplements on your plate. And how to, adjust your diet. We all know the important things, but how do we have those pragmatic steps? What are the practical steps that we're going to put small, consistent steps in the direction of your dream? So it's like scheduling comprehensive health review with me. And so it's a 45-minute consultation. And for people who are not close, you can also do the testing. So my favorite service that we provide is the nutrient testing. So I'm sure you've heard, people doing the big functional health testing and they do. So it's basically something like that, but we do 3 different entry levels. So there's a $200 one, there's a $300 and something dollar, there's a $400 one. And depending on what you need, like a core wellness, metabolic check, and the advanced one with hormones, you do that test and you don't have to come to the pharmacy to do it. So you can do it at any Quest lab and I send the order, you do that test, and then I will sit down with you and go through all your biomarkers and recommend you should not be taking this supplement, you should be taking this one, or there's a dose that you should be taking based on your lab results. And that's really what we do. And I'm on social as Dr. Emlah Tubuo on Instagram, LinkedIn, and Facebook. So I'm really happy and thank you for doing the work that you do. And we were connected by a mutual friend, Eden, and I'm so grateful for her. She's a lovely connector. I'm grateful that she connected us when I opened Power Pharmacy, and you're one of those people who have always been there for me. And I am inspired by the women around me, and you are it.
Oh, well, thank you so much. Oh, and the blessings go back your way as well. Dr. Emlah Tubuo, like such a wealth of knowledge, compassion, and intentionality, showing us how we can live our life a different way. Thank you. Thank you. And I would say to the listener, if today's conversation resonated with you, consider where you're being asked to slow down. Healing doesn't always come from doing more. Sometimes it comes from slowing down and finally listening to what your body is trying to tell you. And please, please, please share this episode with a friend or family member who may benefit. Dr. Tubuo and myself are out to change the world. or at least our communities, and we need your help to spread the word. So please share. And thank you again, dear friend. I will be at the pharmacy sometime soon on the top of the hour to do those squats with you.
Oh, you are welcome. I'm loving it. I love it. Thank you, Dr. Rodensheimer. Thanks for having me.
You're welcome. Have a great day.